First up is a presentation from a very busy Dr. Cara, who is the Director of the Department of Health Services. And she is here to give us a coronavirus update. We are sorry about our technology glitches. If you look over there, it is available. The presentation is available on one screen. And Dr. Chris, if I could interrupt, I think we have the emergency docs here for a visit to Health Committee. Would you please stand and be recognized? Thank you very much, and it's my understanding my wonderful vice chair was just presented an award for her outstanding work in that arena, and this is a good day if you're going to get sick, folks. This is a good day to do that, but don't. Dr. Christ.
Madam Chair, members of the committee, thank you for having me. I'm Dr. Cara. I'm the Director of the Arizona Department of Health Services, and I wanted to give a brief presentation on Arizona's response to COVID-19, or the 2019 novel coronavirus. I will go over a review of the outbreak worldwide to date, give you an overview of what we know about the virus, talk about the numbers. These are the most recent numbers as I walked out of my office today, but they are constantly changing. Talk about some of the public health prevention and control strategies, and then identify some additional resources. And I apologize in advance if this is the second or third time you've heard my presentation. We've been trying to get out, but the numbers do change every time. So this was first identified in China. There were some reports of pneumonia, a severe pneumonia of unknown etiology or an unknown cause. China started responding, the world kind of responded to help find out what this was. In January, it was identified as being a new coronavirus that hadn't been seen being transmitted in people. And so they called it the 2019 novel coronavirus. By the end of January, there were over 9,000 cases globally. The United States implemented a screening at the airports to ensure that we were identifying potential travelers who were infected with coronavirus as they were coming into the United States. The first case of novel coronavirus was detected on January 21st, and Arizona had identified our first case on January 26th. At that time, we opened up our Health Emergency Operations Center, and we have been activated since then. So this is a priority of the department. When they are screening travelers, just to give you a heads up on how they are doing that. So travelers from China and especially Wuhan or the Hubei province are being routed through 11 airports in the United States. Those individuals then are screened by Customs and Border Patrol and by CDC personnel, and they are screened for symptoms to see if they've got a fever, to ask about respiratory symptoms. If they are from Wuhan, China, they are kept in that city in a quarantine or isolation and quarantine for 14 days, depending on their symptoms. And then they are returned to their final destination. If they are not from that area and they are asymptomatic at the time, they will then allow those individuals to go on to their final destination. They will give them education on what to look for and let them know that their local public health departments will be following up. And then Customs and Border Patrol will send us the names of those individuals and the contact information so that we can give it to our local public health departments to follow up, to monitor those travelers. In February, the World Health Organization gave it an official name, so the outbreak is called COVID-19. You'll hear me refer to it instead of 2019 novel coronavirus. And by the end of February, there were 51 countries and over 80,000 cases worldwide identified. And one of the things that we identified last week was that they identified potential community spread in the United States in several areas, California, Washington, and Oregon. So this is the most up-to-date World Health Organization map. We monitor this on a daily basis, but you can see that there are currently a number of countries that are experiencing or have identified cases of the COVID-19. This is updated on a daily basis as part of the World Health Organization's situation report. Let's talk a little bit about the virus. We don't know everything about this virus just yet, but as they continue to find out more and studies are published, we're getting a better idea of what it is and how it's spread. So it's caused by a novel coronavirus. Coronaviruses we know that there are viruses that impact humans. A lot of times it can cause very similar symptoms to a common cold, but they also can cause more acute and severe diseases such as MERS or SARS. They tend to cause respiratory illness, so you can get a cough, fever, shortness of breath, but they can become more severe, and we'll talk about that in relationship to this specific virus. However, they are normally found circulating in animals. Occasionally, they do cross over, and an animal contact with a human can cause that virus then to be transmitted. And then depending on how transmissible it is between person to person determines how quickly it can spread. And so this one does have the ability to be transmitted person to person. With this specific virus, so COVID-19, what we're finding is that there is a very wide range of symptoms. They can range from very mild to severe, even including death. And the symptoms include fever, cough, difficulty breathing. It looks very similar to a lot of the other viral respiratory illnesses that we are seeing circulating right now, such as influenza. A study released out of China that from their Centers for Disease Control that looked at about 76,000 cases showed that about 81% of the cases are mild in nature and did not require hospitalization or advanced care. However, about 6% of the cases are severe, and we'll talk about what puts you at risk for being severe in a moment. We do believe that this is transmitted by droplet transmission. So that means you have to come in contact with somebody who has the virus, and you have to come in contact usually with their saliva or some type of bodily fluid. Usually that's when somebody coughs or sneezes and doesn't cover their cough or their sneeze, and you come into contact with that. Currently, the CDC is recommending airborne precautions, but they seem to be backing away from that with the guidance that they're currently releasing. There is no current medication or vaccine to treat or prevent COVID-19, but there are very simple preventive measures that you can take. And these are the same measures that we ask everybody to take, especially during cold and flu season. But it's washing your hands frequently with soap and water, making sure you're covering your cough, and then staying home when you are sick. What we're seeing with this when we look at who's at risk for developing severe disease, it appears to be the elderly and or those with underlying medical conditions. Children don't seem to be as adversely impacted by this disease as we normally see with influenza, which is a good thing. Those currently at risk for becoming infected with COVID-19, the risk to the general United States public is relatively low. However, as it gets into the community, our concern is heightened. But people with direct risk are those who have recently traveled to an area with ongoing COVID-19 transmission. And that includes China, South Korea, Italy, Iran. They are watching Japan and Hong Kong at this time as well, although the travel recommendations are not as strict as they are for these 4 countries. And then the other risk group is people who have come into contact with an individual who is currently infected or suspected to be infected with COVID-19. So those are the groups that are at highest risk. But as we continue to identify more cases, we will continue to include that expanding risk population. And so the numbers, as we're looking, this is as of this morning at about 8:45. So there are 94,250 cases globally. There's a really cool map that Johns Hopkins is using, and it pulls all of the data from CDC and World Health Organization. You can go there, but these numbers, so as of this morning, there are 73 countries and over 3,200 deaths. In the United States, this is the most recent data from the CDC. The news is a little bit faster on updating than CDC numbers, but the CDC numbers are the official United States numbers. There are currently 60 cases in the United States that have been identified and presented in the United States. There's an additional 48 that were repatriated. So these are individuals that were either on the Diamond Princess cruise line and developed symptoms or tested positive, and then 3 individuals that were repatriated from Wuhan, China. It now is in 12 states, which is different than yesterday. Yesterday was at 10, and there have been 6 deaths. And from what we understand, we believe that Washington has 3 additional deaths. They just haven't been officially updated. In Arizona, we currently have 2 cases. So we have the initial case that was diagnosed on January 26th, and then yesterday the Arizona State Public Health Laboratory identified its first positive here in a individual that had contact with a presumptive positive in a different state. So Maricopa County is currently working with that individual to keep them isolated and away from other individuals in the community. Arizona has had 0 deaths related to coronavirus to date. We are now posting all of the numbers on our website. They get updated every morning at 9 a.m. So this is from yesterday's. We are trying to do same-day turnaround on our public health lab samples that we are testing at the department, and so these numbers will change on a daily basis. So when you look at how public health is going to respond to a outbreak, a lot of it depends on the type of virus it is, how it's spread, what the acuity and the severity of that illness are, and then what are good control measures. Initially, with a response, we will always start with containment of the virus at the source. You try to wrap around that individual to keep that virus from getting into the community. However, as there is more widespread transmission, you will see that public health's activity will shift from a containment more to a community mitigation. And we can talk a little bit through that. So in the early stages of any outbreak, normally what we do is we take steps to contain the disease at its source. So you have one case. This works really, really well in diseases that either have a high acuity, the majority of individuals have visible symptoms and need to seek health care so that healthcare can diagnose them and get public health engaged. And so things that we would do in that case are we would identify cases, we would follow up with that case and identify their contacts. We would ask them to isolate. There are authorities that would allow us to require isolation or quarantine for exposed or potential cases. And then we follow up with them to monitor their symptoms and to get testing out and try to get in front of that disease. That is a much harder thing to do when you have disease that is either mild. People may have a runny nose, may have a sore throat, but they're out in the community. They don't know that they have a disease, or they think they just have a cold or flu and they're out, they're going to work. That's much harder to do in isolation or containment. And so what we have to do then at that point is to take measures to protect our healthcare system, protect those that are at high risk of developing severe disease, and mitigate the risk to the general public. And so you'll see us, as we identify more information, shifting to a different strategy. So what we'll do is, as there's more cases identified in the community, it's not going to be feasible for us to isolate and quarantine. So we'll start working with businesses, with healthcare, with the community to start engaging strategies like reminding individuals to make sure that they stay home from work when they're sick, encouraging hand washing, encouraging the use of hand sanitizer, and potentially social distancing distancing methods, which can include things things as severe as canceling events. We are not there yet, but we are starting to work with our business communities to get them guidance on how to prevent the spread of COVID-19. So here in Arizona, we have been working on this since we heard about it in December. We have been watching and doing surveillance. And then as we've gotten cases or as we've gotten high-risk suspects, we have been implementing control measures around those individuals. Our county health departments in Arizona are the boots on the ground, so they are the ones interacting with the patients, doing the follow-up, doing the contact tracing, and we will coordinate it if it's multi-county. We are also testing for COVID-19 at the Arizona State Public Health Laboratory as of Monday. And then we're also working on developing and distributing guidance for partners. So we are hosting a number of webinars aimed at specific groups on how to prevent the spread, how to protect your employees, how to protect individuals. And some of the webinars we're doing this week include law enforcement, schools, K through 12, colleges and universities, healthcare providers, healthcare facilities, long-term care institutions. So we're really trying to get specific messaging out to some of those groups. We're getting asked now a lot about what people can do to prevent COVID-19, and because there's no vaccine or medication right now that can treat it, it's everyday precautions for preventing respiratory illness. So wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer. Stay home if you're sick so you don't bring it into the workplace and expose your coworkers or the public that you may work with. And you want to make sure that you cover your coughs and sneezes. This is something that I've been emphasizing with my little ones because they don't. But you really want to make sure that you're taking a tissue or the elbow of your arm not into the palm of your hand. And if you use a tissue, make sure it makes it in the trash can so somebody else, like your mother, doesn't have to pick it up. And then avoid touching your nose, eyes, or mouth with unwashed hands, because you can touch surfaces that may have infected droplets, and then if you touch your face, you could potentially transmit the virus to yourself. You want to avoid close contact within a meter of people who are sick. Make sure that you're cleaning and regularly disinfecting frequently touched surfaces. You don't need to do special disinfecting, just the normal wiping down with household or with disinfecting products is completely fine at this time. And in order to help protect our healthcare system, if you've got mild symptoms, consider not going to the emergency room, but maybe trying telemedicine options or going to see your healthcare provider if it can wait. Organizations, so we're working now to get messaging out to businesses, but you want to encourage your staff to stay home when they're sick. I'm really bad about this, but I'm very good about encouraging my staff. But leading by example, so making sure that if you're sick, you are staying home so that your employees feel like they can as well. Reviewing telework policies just in case somebody might need to stay home with a loved one to care for them. But making sure that if you have the ability to telework, that is all set up and you've got the appropriate policies in place. Cross-train staff in case you have high levels of absenteeism, especially for key positions that your business requires in order to continue operating. And then making soap and water or hand sanitizer available at your business. So these are the list. It's not very clear, but we can send you it. It is on our website. These are a list of the webinars that we currently have scheduled for this week. They actually start today. We've got them for law enforcement, health insurance plans, schools, first responders, businesses, long-term care facilities, college and universities, healthcare providers, and healthcare facilities. And we're getting more questions, and we will be developing more webinars. I know that food banks just reached out to us. We'll be developing guidance for them. And then these will, if you can't make the specific webinar, they will be taped and placed on our intranet so that anybody can watch them at any time. And then our website is updated daily. You can go to azhealth.gov/COVID-19. We link to the CDC, but we also have links to the local public health departments in case anybody needs to get their local information. And then cdc.gov is also updated on a daily basis. And if you just go to cdc.gov, it's the first picture on. You can click on that, and we'll get you to the website. Thank you, and I'm happy to take any questions.
Thank you. Before I open the floor to the members, I'm going to ask a few questions, some on behalf of our emergency docs. I have a good friend, Brad Butler, who's an ER doc, and he said every time something like this happens, the emergency rooms are flooded. And what is your advice? What is your counsel regarding that?
So, Madam Chair, that is a very good question. We would recommend that if your symptoms are not life-threatening or you don't have a underlying medical condition that does not require emergency care, does not put you at more severe risk, most people, like with influenza, and if it's a mild case, would likely be fine at home, just making sure that they're drinking lots of fluid, managing their symptoms. And if it worsens, then calling your healthcare provider. There are telemedicine options available, such as Doc on Demand, so you don't even need to leave your house. You can see a healthcare provider on your iPhone or your computer. And then we would recommend that if you can utilize an urgent care or your primary care provider, those are usually a better option than the emergency department.
So are you working with the emergency departments across the state?
Yes. So, Madam Chair, actually what we do is we have a tool called EM Resource, and we every day get updates from the emergency rooms and from the hospitals. They will notify us if they are open, if they are on caution, if they are on divert. If they are on caution or divert, why is that? Do they have multiple behavioral health holds? Do they have a lot of cases? And then they can also put in if they need any kind of resources so that we can work with the coalitions to see if we can get like masks or surgical gowns or those types of things reallocated.
Thank you. And I know a lot of my constituents are absolutely freaking out about traveling and traveling restrictions. Where are you on that?
Madam Chair, so CDC and the Department of State actually have a travel advisory. So we would recommend following that travel advisory. Avoid travel to anybody that's a level 3 or 4. Strongly reconsider your travel if it's a level 2. The 3s and 4s right now are China, Iran, specific areas of Italy and South Korea. But Hong Kong and Japan are on the level 2. I would not, if you're not going to one of those and you have travel plans, I would not recommend changing your travel plans at this time. I would encourage making sure that you had an alcohol-based hand sanitizer and washing your hands frequently, and then trying to avoid people who look like they may be coughing or sneezing, staying away from them.
And thank you, Director. I'm just going to ask a couple more questions in terms of the mortality rates we're seeing elsewhere. A question about internationally, South Korea and Italy's mortality rates, which I think we can maybe trust those numbers more than where other places. What do those mortality rates tell us?
Madam Chair, so right now what they're reporting is between a 2.3 and a 3% fatality rate worldwide. One of the things that we are watching in public health, because while China had implemented more routine community screening, which really increased the number of cases, but it decreased the number of severe cases. A lot of countries, including the United States, have only been testing up until the guidance was expanded, have only been testing severe, hospitalized, or those at high risk for catching them. So what we expect to see is that fatality rate decrease as we start identifying more cases in the community that maybe had not sought healthcare or didn't require hospitalization. But right now, like when you're seeing Italy, most of those were the severe cases, but not the ones in the community that they're not aware of.
Okay, so there could be an overstatement of mortality. So going to a at-home or domestic outlier, Washington State, I mean, they've had 6 deaths. So does that lead to believe that the virus was rumbling around up there long before we actually knew there was a virus?
So, Madam Chair, yes, they have an outbreak in a long-term care facility right now, and those individuals in a long-term care facility or a skilled nursing facility are usually high acuity with underlying medical conditions. And so that is a risk group that is they are extremely at risk. And so they would have a higher severity and death rate. We are watching what Washington is doing, but it is likely that they've had community spread.
I would say so.
Yeah.
My last question is related to the difference between coronavirus and flu. How do we tell? We've just got the flu. My poor friend Senator Pace had the flu, and some people in my office. I mean, how do we know it wasn't coronavirus? He was really sick. Bless his heart.
Madam Chair, yes, I'm sorry, Senator Pace. Influenza is terrible. Good. I'm very glad. The symptoms are very similar. So unless you get tested, you're not going to know likely. You're just going to know that you have a respiratory illness. And when you get influenza, you feel like you've been hit by a bus. It's
Right.
awful. We would recommend right now that everybody get their influenza vaccine. We have a lot of influenza still circulating in the community. And even though that vaccine won't protect you from the coronavirus, you would not want to have influenza barely recover and then get hit by coronavirus. So we would recommend getting your vaccination right now. But until we're able to start testing within the community, which we're hoping will be soon, we won't know if it's coronavirus or influenza unless you're
Thank
tested.
you. So lessons learned, it's kind of like the flu. Don't rush to the emergency room. And if you think you're really, really sick, seek care at the appropriate level. Senator Allen, to that point.
Well, thank you. I guess, I don't know if my question's been answered or not, Madam Chairman. It was about the difference between flu and the coronavirus. But we're so much more focused on this other virus and so concerned, I mean, everything that's happening worldwide, and yet it seems like if you get this flu that's going around, and I've had family members that's gotten the flu and have been very sick for 2-3 weeks. I mean, they can't shake it. So it's like it's worse than this, and yet we're focused on this. And why are we so focused on this other virus?
Director.
Madam Chair, Senator Allen. So yes, we in public health, we take flu very seriously. It's always a concern. I think whenever you have a new virus come on, you are going to see a lot more severe cases initially. They are going to have deaths because that's what we are going to capture in public health. I think given the worldwide events, it's appropriate to be concerned and to watch what's going on, but the prevention messaging right now is the same. So to make sure that you're really trying to avoid both flu and coronavirus, because we do know that influenza kills tens of thousands of Americans every year.
Thank you. Other members? Senator Carter, I think, is going to tell us that Corona beer is a really good antidote. I'm sorry. That's what I derived from her little meme.
Yeah, let's just say the internet is having all sorts of fun with memes in Corona. So, serious questions though. So, I wanted to talk a little bit more about what happened up in Washington in that one particular facility, because then the emergency responders are now also put on quarantine. So, I don't want to create a situation where we have just mass chaos here, but are we in a situation where if anybody interacts with somebody that had the coronavirus, now is everybody going to have to be quarantined for 14 to 21 days? Can you clarify that?
Madam Chair, Senator Carter, so we would work on an individual case-by-case basis to determine whether or not we would quarantine and isolate somebody that came into contact. If appropriate PPE was utilized and they had taken every steps, we may just put them under monitoring. We may ask them, like if it was a healthcare worker, not to continue seeing high-risk patients, but like in this long-term care facility, you might be able to cohort them with the positive, like with the people who are positive for coronavirus, so that they still have care as long as those healthcare workers are feeling well enough. For emergency response personnel, we're working with our first responders right now, but again, it would determine the level of exposure and what we felt their risk was, because we understand that taking healthcare workers and first responders out of the mix for 14 to 21 days could be detrimental to our healthcare system. So we are keeping that in mind as we're moving forward.
So just to clarify then and kind of put a fine point on it, it will be specific to that individual situation. It will not be just a blanket, if you've come into contact now, you are quarantined 14 to 21 days.
Madam Chair, Senator Carter, yes. So the local public health departments will be working on a case-by-case basis.
Okay, thank you. And then, Madam Chair, if I may.
Yes, please.
There was a question around just the supply chain and access to supplies, and let alone, I don't know if everybody knows this, but I guess there was a mad dash to Costco and grocery stores this weekend, and everything was just depleted, like paper towels, hand sanitizers, and spaghetti sauce. Not kidding. Trader Joe's said they had their busiest day of all record on Monday. I mean, people are just stocking up on everything. So my question is, not so worried about not having paper towels and spaghetti sauce, but I'm genuinely really worried about having medical supplies and having access to respirators or any other devices that we may need in an emergency room to treat, the medically fragile patients that may present in the emergency room, and rooms and availability.
Madam Chair.
Director.
Madam Chair, Senator Carter, so that is something that we take very seriously, and that's why we want to protect our healthcare system. So we are hearing shortages of masks and surgical gowns. We are working with the coalition to try to be able to reallocate resources as necessary. The state still has a supply of medical cash that we have, masks, gowns, all types of medical equipment here, and so we are working at getting out those to the counties so that the counties can distribute that to hospitals as they need it as well. We identified at the Arizona State Hospital that we had over 3,000 N95 masks that we'll be able to distribute throughout the community. As we're watching CDC, and I kind of talked about, they went out with airborne precautions, which requires the N95. In their most recent guidance, they decreased that to a droplet precautions, which is just a surgical or medical mask. At that point, that would take a lot of pressure off, because N95s require you to be fitted and fit tested, and they're a specific size, and then you're fit tested to a specific brand. So being able to take that off would take off some of that burden on our healthcare system as well. If it got to the point where we would be beyond the state's ability to be able to secure the equipment that we needed, including ventilators, we can always work with the federal government to request the Strategic National Stockpile, which does have ventilators. We can request Medical Corps to come in and help us, and we can activate our volunteer reserves as well. So there are plans in place to attempt to get additional resources if Arizona was to need it.
Thank you. Any other questions?
Well, just a follow-up question on the
Senator
emergency
Carter.
room. So on the emergency room, being that we have our emergency room doctors here, they go, the emergency room go on, is a diversion where you,
Yes.
so is there a statewide plan in place where it will be even more comprehensive than just regionalized in the local area, where you're going between 4 or 5 different emergency rooms, but now you might be looking at a whole statewide diversion program?
So,
Director.
Madam Chair, Senator Carter, we do look at it from a statewide basis right now, and if we needed to work between counties and that to get resources to them, we absolutely would. We do have, if it gets, so we've got our influenza pandemic plan, which is what we are following right now, because this appears to be very similar to a pandemic influenza, the way that it's transmitted. If it were to get severe and we didn't have enough ICU rooms, there are things that we can do, such as waive licensing rules and to see if we can get waivers from CMS so that facilities don't need to meet conditions of participation, to kind of offload some of the regulatory requirements so that they can continue to do that. I know in H1N1, we had worked with a couple of hospitals to set up like triage tents outside so that we could triage individuals. Arizona is one of the few states that has a crisis standards of care plan, and that's really what determines, like, if supplies get extremely limited, how the state prioritizes and reallocates those supplies. And that's activated by a public health emergency declaration, as well as the director in consultation with the governor.
One more, just quick question.
Senator
on
Carter.
just the
Okay.
last
I want to
one.
make sure other members also have time to
Thank you.
ask questions.
So how many, thank you, Madam Chair, how many on a day-to-day basis tests do you predict will be coming into the state lab for testing? I mean, because you're going to obviously be testing a large number of, and it's not going to be everybody that presents with symptoms. It'll be the individuals that the emergency care and or primary care feel that need to be tested. So what do you think that volume will look like?
Madam Chair,
Please.
Senator Carter, I think it's difficult to predict right now because there are screening tests that are going on prior to, unless they've got travel. But if it was somebody that just showed up, they would have an influenza done first, they would have a viral respiratory panel potentially done first, and then it would come to the state lab. As it becomes more commercially available, and from what I understand, Mayo and LabCorp are currently working on that, as well as TGen. What we are hoping is that then that would just be a send out to the community to do it as part of the respiratory panel. It'll depend on how they do that. But right now, the tests need to be cleared by public health, so they have to meet specific criteria for us to be able to test under the emergency use authorization. But we're working on that, and we heard yesterday that there may be new guidance coming out from CDC expanding the ability of that. So I think, like, right now we're testing somewhere between 3 and 6 individuals a day. They'll have multiple samples, but it's hard to say what we'll see as it gets more into the community.
Thank you, Madam Chair.
Thank you. Any other questions? Thank you, Senator Steele.
Madam Chair, I know that I asked you yesterday in your other presentation. I just wanted to give you another chance to just say what you said then, because it was helpful. A lot of people have talked to me about not feeling that it's okay for them to call in sick if they're worried about it because they're afraid that it will look bad for them at work. What would you tell employers?
Director.
Madam Chair, Senator Steele, so we would tell employers to adopt a flexible workplace or like a sick leave policy. We know that every year with influenza, people do get sick. They need to stay home. People get really sick with influenza. And so we really want to limit the spread, especially to at-risk populations. And multiple people, even in this room, could be at risk. And so you don't want to expose those that may be more vulnerable. And so we would encourage employers to make flexible policies that not only allow individuals to stay home when they're sick, but also to stay home when if their family members are sick and they need to care for them as well.
Thank
Madam
you.
Chair.
Senator Navarrete.
And thank you again, Dr. Kirst, for being here. You've heard this question before because I've asked you as well, and I really do appreciate the tour that you're going on, making sure that folks are getting informed across the state, and also with different members of the legislature. The question that I have for you is really, as the federal government is also moving to act on the coronavirus and prevent the spread and prevent any more deaths due to the virus, can you tell me a little bit more about how those federal dollars will be spent here in the state of Arizona?
Director.
Madam Chair, Senator Navarrete. So that's a great question. We are hearing that there will be an appropriation of federal dollars to respond to COVID-19. A lot of the federal dollars that we get would go straight to our county health departments and our tribal health departments so that they can do the actual boots on the ground work that they need to do to prevent the spread and to control this disease. Other things that the funding would go to would be for lab supplies, additional testing capabilities so that we could expand, and then the testing reagents and those types of things. Public education messaging so that we could get that out, the ability to be able to provide like technical assistance packaging for businesses so that they would be able to do that, as well as expanding the capabilities of our centers for excellence and to get more community available testing. Those are the main priorities. And then to support the epidemiologists and the staff at both the local and the state health department.
Thank you. I think we're done. We so appreciate your tireless efforts in this regard as the guardian of public health here in Arizona. And really, I also have to give President Fan a shout out. We have all our pages and gnomes going through the building before we get here, wiping down doors, doorknobs, and the little Purell things that are out. I think we're doing everything we can to keep people who enter the Senate safe and well. But most of all, thank you for your efforts and your successes in this regard. We very much appreciate the work of DHS.
Well, thank you.
Next year, you'll be here telling us about the vaccine, right? Right. Thank you.